Hello, and welcome to Health and Back, a podcast about how health, medicine, and wellness decisions from the past help inform us today. I'm your host, Madeline Leggett. In this episode, I'm sitting down with Dr. Najera to talk about the history of vaccine skepticism and how those past instances reflect what we're seeing today with the COVID-19 vaccines.
You know, there was vaccine skepticism before there were vaccines, and that's something that always kind of befuddles people. Like, what do you mean?
Vaccine skepticism today comes in light of the COVID-19 pandemic. On December 11th, 2020, the U.S. Food and Drug Administration issued the first emergency use authorization for a vaccine for the prevention of COVID-19 in people 16 years and older, which allowed the Pfizer-BioNTech vaccine to be distributed in the U.S. Later, the Moderna and Johnson & Johnson vaccines were approved as well. However, on April 13, 2021, the Centers for Disease Control and Prevention and the FDA recommended a pause in the use of Johnson & Johnson's vaccine. Of the almost 7 million doses administered so far in the U.S., a small number of reports of a rare and serious type of blood clot have been reported in people after receiving it. All reports happened among women from the ages of 18 to 48, and symptoms occurred 6 to 13 days after vaccination. Dr. Richard Besser, who is the acting CDC director in 2009, spoke about the implications of the Johnson & Johnson pause on C-SPAN on April 18, 2021.
First, I do think taking a pause was the right response. We have a number of systems to report what are called vaccine adverse events. And then they're investigated to see, is this something that was just occurring in a time frame related to vaccination, like someone who had a heart attack and they had a vaccine last week, but it wasn't caused by the vaccine, or is it something that the vaccine actually could have caused? And so in these systems of reporting, they detected 6 cases of a very rare type of blood clot in women who were all younger than 50. Within 2 weeks of having received the J&J vaccine.
Although the Johnson & Johnson vaccine use resumed on April 23rd at the recommendation of both the CDC and the FDA, public health experts were worried and still worry about how that pause could impact vaccine hesitancy and skepticism in the U.S. Still, vaccine hesitancy isn't new. Here with me to talk more about vaccines and the history behind them is Dr. Najera. Hi, Dr. Najera, and welcome to the show.
Hi, how are you?
Hi, I'm good. How are you?
I'm doing well.
Could you state your name and sort of tell the audience who you are?
Yeah, so my name is René Najera. I am an epidemiologist, doctor of public health. I'm a senior epidemiologist at a local health department that shall go unnamed. But my reason for being here is that I'm the editor/project director of the History of Vaccines project by the College of Physicians of Philadelphia.
Although public mistrust of vaccines is currently an issue, it's been a problem in the world of public health for some time now. We could look to the case series published in The Lancet in 1998 by Andrew Wakefield and 12 of his colleagues that suggested the measles, mumps, and rubella, the MMR vaccine, could cause autism in children. Like I mentioned, vaccine skepticism begins way before that study, and like Dr. Najera said earlier, vaccine skepticism precedes vaccines themselves. He pointed to waves of smallpox in the 18th century and gave me an idea of what it was like.
So back in the early 1700s, smallpox, a disease that was terrible, horrible disease, 30% death rate. If you survived it, you were scarred. A lot of people would actually commit suicide from the scarring because they just couldn't bear looking at themselves. And almost everybody got it. You know, it would go around in waves, not pandemics, which is it happens worldwide at the same time, right? It would go around in waves every 15 to 20 years. So every generation, you build up enough people who are susceptible and then boom, it would hit you. Everybody who knew something about medicine had to find a way to stop it. And at the time, we scientists didn't know what a virus was. There was no such thing as a microscope. There were hints that there was something infectious going on. There were hints that your body did something to protect you after infection, because once you got it, you were immune afterward. So there were these little hints here and there.
But inoculation techniques didn't originate in Europe. Researchers and historians say that the two most likely origins were either China or India, and Dr. Najera spoke about the former.
But if you go back 1,000 years, the Chinese, they realized that if you took some of the scabs from the smallpox and you dried it out in the sun and then you ground it up into dust, and if you inhale that, you got some sort of immunity from it. Again, probably a lot of trial and error, probably a lot of observational studies, nothing really scientific. And so they did it, and it worked. And it was called variolation or inoculation. And this practice then leaves China through the Silk Road, heads west, India, they pick it up, Middle East, they pick it up, North Africa, they pick it up. But it doesn't make any inroads into Europe. It just kind of, it's one of those things that those people over there do. They're kind of weird. They're not like us sophisticated Western people.
This practice didn't make it to America until much later.
In the early 1700s, this enslaved man is picked up in Africa and taken to Boston, and he is sold to a congregation at a church, and the congregation gives him as a gift to their Reverend Cotton Mather. Cotton Mather was involved in the Salem witch trials, but he basically notices that Onesimus, the slave, is immune to smallpox. He doesn't have any scarring. He's fairly older, and he says, "What is protecting you?" And Onesimus says, "This scar." And what is that? And he said, "Well, they gave us smallpox without actually giving it to us." And Cotton Mather got kind of curious and says, "Tell me more." And so Onesimus describes a procedure where they would take somebody with smallpox and take a little lancet and lance the pox and get the tissue or the fluid and then put it in their arms. And they were sold at a higher price because they were now immune from smallpox, and that would make them profitable. And so Cotton Mather goes to a friend who's a physician, a last name of Boylston, and says, "Hey, is there anything to this?" And so Boylston writes some letters to some friends and colleagues in Europe, and they say, "You know what? There's this woman who is married to the British ambassador. Her name is Lady Mary Montague, and they traveled to Turkey. The British ambassador to Turkey went there, and it wasn't called Turkey at the time; it was the Ottoman Empire. And she has written back saying that there's this practice of doing that in the Ottoman Empire, and people are immune." And there's this whole process to it. It's very controlled. You don't want to get too much of the smallpox. You want to get just enough to give immunity. You want to do it under the supervision of somebody who knows what they're doing. And they didn't know this at the time. There was variola major, variola minor. And they said, you don't want to get the bad one, the major. You want to get the minor and give that to people. It wasn't that minor. It was like 5% death rate. So she writes letters to her friends and colleagues again. And by colleagues, I mean people in the higher echelons of society in Britain, and says, look, I just had my child inoculated, and he had a fever for a little bit, but he got over it, and he didn't develop smallpox. You guys should look into this. Her letters, Boylston's letters, other people's letters start traveling the world, and there's confirmation that it works. So then a ship arrives in Boston in early 1700s, 1710s or so, and the sailors have smallpox. And it had been a while since the last smallpox outbreak, so here we are, beginning of a smallpox outbreak. And Cotton Mather immediately tells Boylston, hey, this inoculation thing, let's try it. It's worth doing. Let's just go for it. So they inoculate themselves, they inoculate their families, they inoculate the slaves working for them, and it seems to work. If you look at the death rates of people who got smallpox the natural way, it was about 10 times worse than the people who were inoculated, because you didn't inoculate everybody on time. Some of them were already infected.
But just like today, not everyone was a fan of the inoculation idea.
So Boylston and Mather said to the town leaders, hey, let's do inoculation. And people lose their minds. They firebombed Cotton Mather's house. They wrote very dissenting opinions in the press. Cartoons were made. They were saying, number one, why would you put the filth in us? Number two, what are you doing listening to a slave? What does he know? Number three, what are you doing listening to the Ottomans? What do they know? It snowballs from there. And this is kind of the same reaction that you get in other places. They just have this adverse reaction to inoculation. Later on in the Revolutionary War, Washington is defeated at a battle up in New York State, or what would be New York State. And he realizes that it's because his troops are sick with smallpox, that the British had smallpox, and a lot of them already are not immunized. They're immune from having smallpox. They're the ones that survived, right? And so he hears about inoculation, and he forcefully inoculates his troops. Like, he actually had people held down and given the inoculation against their will, because he said, look, we're not going to lose the war because you get smallpox. And you have several instances of this. Benjamin Franklin writes the opening to a pamphlet talking about the benefits of inoculation. Like in Hamilton, to every action, there's an equal opposite reaction, and people rebel against it. They're, number one, no, the government is not going to tell me what to do with my body. Number two, yuck, and you don't know what you're doing. This is all before the first vaccine.
But the first true anti-vaccine sentiment evolved around the early 19th century with the first vaccine.
The first vaccine happens in 1796, which is a smallpox vaccine that is taking cowpox and doing the same thing that you did with smallpox. You just did it with cowpox. Cowpox doesn't cause a severe disease, doesn't cause the scarring, doesn't cause death. You kind of feel icky for a while, but you get over it, and then you're immune against not just smallpox, but other, as we found since then, other pox viruses. That is the first time that there's this anti-vaxxer sentiment growing. So by the time the first vaccine comes around, the groundwork is already laid out. They already have their talking points. They already have their celebrity figures who are opposed to this. President John Adams was, he heard about the smallpox vaccine, and he was like, no. Thomas Jefferson, he heard about it and was like, oh, that's interesting. Let's look into it. And he kind of helped promote it. So the groundwork was already there by the time the first vaccine comes around. First vaccine comes around and you see the cartoons. Oh, this cowpox vaccination is going to turn you into a cow. If that sounds familiar, to the COVID vaccines, the mRNA vaccine is going to alter your DNA, make you into something non-human. They're taking the cells from the cow and putting it into you. Now we hear they're taking fetal cells and putting them into you. Moral and religious grounds. If God wanted you to die from this, then you're just going to die from it. Sorry, And now you hear religious figures saying the same thing. No, don't get tested, don't get vaccinated. If God wants you to suffer, then you're going to suffer. Okay, those kind of things. Unfortunately, now you have mass media, social media. You have people who have huge followings on the internet that they say something and a lot of people listen to them. And we found in our research in public health that people listen to people who are like them. And so all you need is a critical mass of people listening to you as an influencer, and that critical mass will influence a ton of more people. It just spreads. And so it's the same thing with pro-vaccine. We try to reach the critical mass of people who will tell their peers the benefits of vaccination and get that going. And it's kind of the reason why vaccination programs for kids are so successful. You still have vaccination for school requirements up in the 90s, because for the most part, you hear about things that happen, but you don't see them, right? You don't see, they say that children turn autistic. Well, no, they were always autistic. You just kind of figured it out later on. You don't see the deaths that anti-vaccine people say that exist. You don't see those kind of things, and so that's why it's been so successful. The only problem is that there's things like measles that if you drop down below 95, 96%, you start messing with herd immunity and outbreaks come back. But yeah, no, the history of the anti-vaccine movement has been around longer than vaccines, and it's kind of annoying that it hasn't died out, and they just keep recycling the same thing over and over again. In the mid 1800s, the British Empire said, okay, everybody get vaccinated against smallpox. And they actually call themselves the National Anti-Vaccine League, because they couldn't sound like a villain more than that. And then they spread their tentacles throughout the whole world, sending letters everywhere. And then there was one created in the US that would actually fundraise off of the fear of vaccines, using the talking points of, the government can't tell you what to put into your body. You're healthy enough as it is, just live a healthy life and you won't get sick. And then the moral grounds, if it was meant to be, it was meant to be, and things like that. And so they came about and they started suffering some blows in the 1900s because science has advanced. Now we have microscopes. Now we know what things are. There's more respect towards scientists. It was a golden era of science. People like Pasteur, who found the vaccine for rabies, hailed as a hero. There was a Dr. Hafkin, who found the vaccine for cholera and for the plague in India, probably averted millions of deaths from those in India. They're held as heroes, and there's more of that happening.
Mandatory COVID vaccinations are a hot topic, as various colleges, like Yale and Columbia, just to name a few, plan on requiring COVID vaccinations come fall. Government intervention in the context of vaccinations and public health is especially relevant today, but it's historically relevant as well.
And then the Supreme Court steps in. There was a man by the name of Jacobson in Massachusetts who didn't want to pay a fine if he wasn't vaccinated. He said that he had some really bad vaccine reactions when he was a kid, and he wasn't going to get the vaccine, and neither were anybody that he would look after. And the state said, that's fine, but you pay a $5 fine, which in today's dollars is close to $150. And he said, no, I'm not. And he took it all the way to the Supreme Court. The Supreme Court said, actually, yeah, the state cannot forcefully vaccinate you, but they can fine you because they have that power. It's under the 10th Amendment. It's the police powers of the states. And that echoes with us today, 100 years later, because the interventions for COVID that you see, whether to wear a mask or not, whether to social distance or not, is very locally controlled or state controlled because of that decision. Because the Supreme Court then said, yes, it's not up to the federal government, it's up to the state and local governments to enforce public health laws. And it came from this anti-vax sentiment of, no, I'm not getting it. And it happens to today. Later on, another court decision, Zucht versus King, they sued the school system saying, no, you cannot require me to be vaccinated for school. And again, the Supreme Court said, yes, they can. You know, your right to be free of vaccination does not preclude the right of the entire population to be free from disease. They cannot force you to get vaccinated, but they can fine you or they can prevent you access to public spaces. And you see that now, right? You can't make me wear a mask. Well, no, but we won't let you into the store, or we won't let you into public buildings and stuff like that. So it just, you know, that's the thing about history. That's the thing I've learned in managing the history of vaccines and running the project, is it keeps repeating itself over and over and over and over again. So whenever somebody brings to me something new, quote unquote new, that the anti-vaxxers have done, I've been like, no, there's nothing new under the sun when it comes to them. I'm not surprised anymore by the things that they say. I'm disappointed.
Although Black, Latino, and Indigenous people, along with other people of color, are overrepresented in serious COVID-19 cases, vaccine hesitancy among these communities can complicate the decision to be vaccinated, and Dr. Najera spoke to this skepticism.
So you're talking about 300 plus years of terrible abuses to people whose origins come out of Africa. That community alone, which is not a community, it's many communities, is just time after time, the abuses, you read about these and you become more, as they say, woke, but you become more aware of all of that has happened. And you like, well, no wonder they're going to be skeptical of the vaccines given by the government. It's the same government that enslaved their ancestors. And in some cases, you still have some people who are alive whose grandparents were enslaved. You have the Tuskegee Experiment in which, there's a misconception in the African-American community that people were given syphilis. That's not what happened. What happened is that people who had syphilis were told not to seek care. They were told that they were already getting care when they were not. And this is in an era of antibiotics already. So they could have been given antibiotics and cured from syphilis because the scientists wanted to see what syphilis would do to people when there was already plenty of documentation of what syphilis would do. Again, the government and the scientists could have prevented a lot of death and suffering, and they didn't because they were racist. And then you have Henrietta Lacks. Henrietta Lacks, neither she nor any of her relatives or anybody close to her benefited from her cells, but so many other people have. You have institutions located in cities that are predominantly Black that conduct a lot of research and use a lot of people of color for their research, and then the benefits of that research rarely, if ever, gets back to them. So you have this history that just goes way back. It keeps repeating itself. Anybody who knows anybody knows about this. And you cannot be surprised that they would be skeptical of a vaccine. So that is mostly in the African American community.
The Latino community has also historically faced discrimination in the medical sphere.
In the Latino community, what you have going on there with Central Americans is that there was a time in the 70s and 80s when pharmaceutical companies went to Central America. They conducted experiments that actually benefited the people who were in the experiment. The medicine worked. But then they said, the medicine works, we're out. And then the people were like, well, can we get the medicine? And like, you have to pay thousands of dollars for the doses. Why? And so there was that abuse. There were medical experiments on the contraception pill in Puerto Rico that went sideways because, contraception pills cause a higher rate of blood clots and other things. And when they were perfecting that, there were side effects, and people in Puerto Rico remember that. The people of Puerto Rico as well had an island, a beautiful island that I've been to called Vieques, and it was being bombed by the U.S. Navy for target practice. So you have that history in the Latino community. You have the fear of those who are undocumented. No, I'm not going to put myself on any registry. I'm not going to register for the vaccine. I'm just going to keep laying low because I don't want to be deported. And you have all of that going on as well. So it's understandable.
Dr. Najera touched on some of the abuses Indigenous people in particular face at the hands of the U.S. as well.
And then you get to Native Americans, right? And then, the Trail of Tears, the forced removal from their land, the taking of their children to make them whiter, things of that nature. And again, it's like, okay, well then, yes, I understand why you wouldn't trust what is called the Indian Health Service to give you the vaccines that you need. And it's sad because they are the ones that are being affected the most by COVID-19, and they are the ones who are being targeted the most as well by anti-vaccine groups. You see it all the time. You see these luminaries, anti-vaccine luminaries, reaching out and saying, we're doing this for social justice. Stay away from the vaccine. When in fact they're doing the opposite. They're causing more death and disability in those groups, as we know. I don't know what the solution to that would be. I sometimes I think that a model like South Africa of the truth and reconciliation efforts that were done after apartheid kind of really worked, and having something like that here where us scientists sit down and say, yes, our predecessors were horrible to your predecessors, even to yourselves, and we don't want to do that anymore, and including more people of color, a little bit more diversity in the scientists that speak out. I was watching the Congress hearings just now. Dr. Fauci, old white guy, right? So while he is very appealing to us scientists who are geeks about him, he doesn't really have that impact with a young urban African American kid who's barely getting by, who probably has lead poisoning from the house that he lives in, or she. And so Fauci, who's that? I have other people that I look up to who don't encourage me to get vaccinated. And so, yeah, it's a struggle. It's a struggle. We're making inroads through scientific means, focus groups, surveys. We recruit marketing people who know how to sell things to people, because that's what we're doing. Basically, we're selling the vaccine without actually cashing in on it, contrary to popular belief. So it's an issue, and it's rough.
The history behind and surrounding the polio vaccine is a good example of health inequity regarding vaccinations.
I wrote an article on medium.com called When the Vaccine, and I wrote this back in, September of last year. And when the COVID vaccine rolls out, it's not going to be equitable, is it? I use the example of the polio vaccine. When the polio vaccine rolled out, the kids who were left out in the cold were the African-American children, for the most part, because this was done in collaboration with schools. So you're targeting children, so who better to target than the schools, or to partner with than the schools? And this was shortly after Brown versus Board. So the schools were not desegregated yet, although they were on their way. And so who benefits the most? White, affluent children. And even there is some evidence that even white, poor children in the South did not benefit from the polio vaccine as much as their white, affluent counterparts. And so, you have those inequities time after time. It happened then with the polio vaccine. It has happened with the HPV vaccine. If you didn't have, at the very beginning of it, if you didn't have insurance, you couldn't get it. And so who doesn't have insurance? More often than not, poor individuals who are people of color, who, because of their lack of health insurance, don't go and get their annual exams, and they end up being the women who have cervical cancer because of something that was completely preventable and completely treatable, and then it got out of control. So, those kind of issues always pop up.
It's these inequities and discrimination within medical settings that led to what Dr. Najera calls Public Health 3.0.
We call it Public Health 3.0. So Public Health 1.0 was going after diseases, infectious diseases. So, potable water to get rid of things like cholera, sanitation to get rid of communicable diseases, STIs, sexually transmitted infections, so all that was Public Health 1.0. Then we moved into Public Health 2.0, where we went after chronic diseases, cancer, diabetes, obesity, things like that, mental health. And then now we're moving into Public Health 3.0, where we are bringing it all together, along with the social determinants of health. Where do you live? How much money do you have? How old is your house? Things that you cannot really control that much also influence your health. And so that's where we are now. Where do you come from? What zip code do you live in? And there's this whole campaign about zip codes, and they say, what zip code you live in determines your health. It's called the ecological fallacy in epidemiology, but I can see where they're going. I'm not going to get too technical on that. But yeah, with Public Health 3.0, we're looking at the environment and influence, social environment, physical environment, and environment, to how it affects public health. And in that, vaccines play a role because, as climate change happens, for whatever reason it happens, right? You have that nonsense debate going on. As climate change happens, you have more mosquito-borne diseases, Zika, taught us a lesson back in 2016. We're going to need a vaccine for that eventually. Yellow fever, there's a safe and effective vaccine for that. Dengue fever, there was a vaccine, but it had to be pulled from the market because it was causing more trouble than the disease itself, mostly in children. So that needs to be refined as that happens. As populations migrate, we're going to need to catch them all up on their vaccines before we integrate them into the school systems. We see that with the kids at the border right now. Even though there's really good vaccination programs in Central America and Mexico, they still need to be caught up with some of their vaccines. A couple of years ago when measles was going around, there was a shelter in Texas that just had a huge measles outbreak. They had a couple of children who died from influenza, things that don't usually happen.
The political environment also has an effect on public trust in vaccines.
On the one hand, the Trump administration botched the response to COVID-19. Things could have been much better. On the other hand, they did throw a lot of money at the vaccine development, and that's probably why we have a vaccine so fast. Although we can talk about mRNA vaccines being around since 1990, but it's part of that there was that to be said. Because people like to say that to me sometimes, like, can you say anything good about the Trump administration and COVID-19? Yeah, the vaccines, Operation Warp Speed. And that's it. And so, yeah, the political environment as well has an influence in all of this. And going back to the anti-vaxxers, they latch onto those things. We used to think that anti-vaccine people were mostly suburban, crunchy granola moms, right? More likely than not, liberal, well-educated, college-educated, blah, blah, blah. But now it's shifted. Now you see anti-vaccine groups and individuals targeting right-wing, anti-government, Trump-supporting people for their fundraising efforts. That goes back and forth like that as well. In the future, if it suits them, they'll go after a whole other group, because that's kind of how they operate. They try to get to the majority of people that can fill their bank accounts.
I also wanted to ask Dr. Najera about mRNA vaccines and the history behind them. Although there's lots of discussion today about these types of vaccines, they're not exactly new.
Yeah, so back in the 1990s, well, actually before the 1990s, scientists figured out that your cell, when you had to make a protein, or when your cell had to multiply, the DNA in the nucleus of your cell would send a signal out to the rest of the cell. Hey, start making insulin, for example. And that message went in the form of mRNA, messenger RNA. And messenger RNA goes out and gives the instructions, the template for a protein, and your ribosomes make the protein. Insulin, saliva, tears, whatever you need to make. It comes in that signal, hormones, etc. And in the 1990s, scientists figured out that there were these mice who had what is called diabetes insipidus. They're missing an antidiuretic hormone. And they said, well, what if we were to send the message, the mRNA in there, and say, hey, make the hormone? And so they did, and they were very successful at it. And it started from there. The problem was that they couldn't scale it up because more advanced immune systems, like apes, as we are, would take the mRNA and immediately attack it and get rid of it before it could do its job. Then in 2005, while eating, this is my theory, while eating M&Ms, somebody figured out, like, oh, what if we put the mRNA in a shell? And so they did. They put it in a lipid nanoparticle shell. Lipid is fat, and so that way it would elude the immune system and get to the cells where it needed to work. The mRNA gets to the cell, the cell absorbs it, and then the mRNA signal says, hey, make a protein, a hormone, antibodies against cancer cells. That's what it was being used for.
Then COVID-19 happened.
Shortly before COVID-19, they were already working on other infectious diseases. They said, hey, what if we tell the cells to make the spike protein that looks like the spike protein on the virus? And that way the cell will make that protein, and your immune system will react against that protein and make antibodies, and you're good to go. And so they said, okay, let's give it a shot. And instead of going sequentially, because of the money that came in from Operation Warp Speed, they did everything they had to do at the same time. So at the same time that they were perfecting the lipid nanoparticle, they were recruiting people for the vaccine trial. At the same time that they were splicing the mRNA with the proper signal that they needed, they were already looking at people's immune responses to previous infection from COVID. This is 6 months already into the COVID epidemic. They said, okay, this is the mRNA signal that works. This is the outcome of it. This is the safety of the preservatives. Let's just go and run with it. My wife actually participated in the Moderna mRNA trial starting in July. And she reports the same symptoms that I got when I got the vaccine. Of my arm really hurt the first shot. Second shot, I actually got like a flu-like illness and was laid out. And if you know the man flu, it's pretty bad. I was laid out for a day, but then felt fine by the third day. Same thing with her. And so the mRNA vaccine is just a new technology. Now we've hit this new leap with the mRNA technology. We don't need to grow the virus in the lab. We just need to know some lab in China opened up the virus and did the DNA analysis or RNA analysis on it and gave us the sequence. And then here in our lab, we put the mRNA together. We don't even need to grow the virus. We don't need to worry about biosecurity here. We just have the mRNA, we package it, and that's the vaccine, and it's good to go. So that's a heck of a leap. Right? You don't need these enhanced biosecurity labs all over the place. You just need it wherever the disease pops up. You want to look into it. You can text message the code of the virus. It's that short. You can ATCGTT. I guess it's U because it's RNA. So this is a heck of a leap, because now we can crack open any virus out there, any bacteria out there, create the mRNA, and then our own cells will create the proteins against which we'll react and give immunity. And that is huge. I foresee, I personally don't invest in biopharma or big pharma to not have conflicts of interest, but I'm very curious and very enthusiastic about what is coming down the pike, because a lot of vaccines are going to be made this way now. It's super safe. It's quick turnaround. So if anything else pops up on the horizon, another pandemic, we'll have a vaccine just as fast, if not faster. And it seems to be working, right? At the county where I work, the number of cases and deaths at long-term care, which were the first ones to get vaccinated, have dropped precipitously. They're super low. The safety profile is excellent as well. Almost 100+ million people vaccinated in the United States. Nothing like what we saw with Johnson & Johnson.
We recorded our conversation a few days after the Johnson & Johnson vaccine was paused. I asked Dr. Najera for his take.
Johnson & Johnson, there's issues there that are being sorted out, which is actually a good thing. It's a good thing that 6 cases out of 7 million people actually triggered this pause, because that means that the system is working. That the system that anti-vaxxers say is non-existent for safety, it actually exists, and it's actually there. I tweeted out at a few anti-vaxxers and I said, well, you've said that nobody's watching out for safety, but yet this happens with Johnson & Johnson. Do you have any comment? And it's crickets, or I get blocked. So yeah, we're into a brave new world of vaccination with mRNA, and hopefully that'll make vaccines even safer, because in the future I can swab myself, send it out to a company like we do now with 23andMe and others, and they can look at my the genes that'll make up my immune system and say, okay, you know what, we're going to tailor the vaccine to your immune system, so you don't get hives, you don't get a bad allergic reaction, a fever, etc. You get immune, but you don't get all those other things with it. Personalized vaccines in the future, it's coming, and I'm super excited about it.
Some people are left wondering why they need to get a COVID-19 vaccine, especially if they're not at high risk for the disease. Dr. Najera shed some light on the importance of getting vaccinated.
For the most part, COVID this is the honest truth, is it's a benign disease, right? It's not the 5, 10, 30% mortality rate that we see with other diseases. That's all fine and good. Children are not being affected. My daughter has been going to daycare, hasn't had any issues. On the other hand, it's not a benign disease. Enough people are dying. Enough people are getting sick from it. We have the long haulers, from COVID. And we don't really know what's going to be the long-term effects of even an asymptomatic infection. We're learning more from it, but why? Why do we even need to go through that if we can end it all with a vaccine? There's 4 other coronaviruses in human populations that they cause head colds. They cause severe respiratory illness at times. Not a big deal. We kind of become adapted to them. This is probably going to be the 5th one that does that. But why? If you can avoid a cold a year, why not? With something that is very safe. It's very effective. We humans are really, really bad at estimating risk. When the 737 aircraft had issues, there were 2 crashes. Terrible, sad, a few hundred people died. That's not good. But at the same time, millions of people traveled on those planes without any issues. We grounded them. right? We grounded them. I know of people who didn't want to fly anymore, not even a 737 that was another type, not the one that had issues. They just didn't want to do it. They went online when they bought their tickets and made sure that it wasn't a 737 flight they were getting. Flying is the safest, to quote Superman, is one of the safest ways to travel, but we get scared by those instances. There's about 30,000 people a year that die in car accidents, and yet we jump on a car all the time. I commute to work and back, and I never think about those 30,000 people that have died, and it doesn't horrify me. I guess there's something about falling out of the sky that horrifies people. And so, risk, that's the kind of thing. A lot of anti-vaccine or vaccine hesitant parents that talk to me, and they say, there's a 1 in a million, but why be the one in a million? I said, well, you had more risk of getting killed on your way to groceries than you do on your way to getting than you do by getting the vaccine. And they kind of like, you see the wheels turning. And so, while on the one hand, yes, it's true when people say, oh, it's less than 1% of people who get COVID will die. Yes, it's true, but enough people are dying. It's going to become endemic if we don't do something about it. So it's going to cause disease in the future. More children have died from COVID during the pandemic than died from influenza on average in the last 5 years. So it's obviously affecting children at some degree. And then why go through that if you can get a shot and that's it, and we end it and it's over. The other thing is you have to think long term. This is not going to be our last pandemic. We had one in 2009 and we got super lucky because we already had testing for flu. We already had the flu vaccine ready to go. We had oseltamivir that although it doesn't work as well as it should, it does prevent severe disease. So all those things were in place, and most of us were already used to getting a flu shot every year, so there wasn't as much hesitancy there. And so we got super lucky. This one we got kind of lucky that even with a relatively not good response from our government, we still managed to not get a lot of people killed, although 500,000 still a lot. We're sort of lucky that mRNA technology exists, etc. And so this is all learning towards the next thing. One of the things that keeps me up at night is called Nypa virus out in Australia and Southeast Asia. And one of its cousins, they're both cousins of rabies, and they're airborne. And so you can imagine airborne rabies. That does keep me up at night, because if we had one of those pandemic of that, up to 30 to 70% mortality rate, that's an extinction level event, right? And so when you say, well, what does me getting a vaccine now have to do with, if something like that happens then? Because now we get to practice for that happening, should it ever happen. And the chances of it happening are increasing because people are moving into the animal habitats. Animals are moving into where we live. We're coming into close contact with bats and with wild animals that carry these things. And you could have a situation like that. And so we need to be prepared as a society. I need to, as an individual, I need to learn to get my vaccines on time, to follow my physician's advice. It's just part of being a responsible part of society.
For those who are nervous and haven't gotten their vaccines yet but are eligible, Dr. Najera recommends it.
So it would be very easy for me to say to not be afraid, right? Like I know the science. I've read the books. I crunched the math. I've taken the vaccine myself. My wife took it as well. But I must say that when I went to take my toddler to get her first shots when she was a baby, I did kind of have a visceral response when I saw the needles go into her. Like, it did make me afraid, and like for a quarter of a second, I thought, well, what if I'm wrong? What if the science is wrong? And then the rational brain took over and said, no, like, it's safe. She'll be okay. The same thing with me when I do these, I do these interviews and stuff like that. A lot of them are in Spanish, and I try to connect to people in that way, saying, look, I'm an immigrant. I grew up in Mexico. I'm here now, and I totally get it. Me too. I for the longest time, I even though I came here legally, I didn't want to get on any registry because I had heard about deportations and I heard about all these things. And so, people are like, oh yeah, and they end up wanting to get the vaccine. So those are the kind of conversations, peer to peer more than authority on down, that seem to work. And so in public health, we are reaching out to community leaders, to religious leaders, and others, and partnering up with them to deliver those messages.
Because the COVID-19 pandemic was so politicized, some experts think that added to the fear of vaccines and the public mistrust surrounding them.
I think that we need to put things aside that get in the way or make us fearful. For some people, it's politics. They like to believe President Trump when he says, I got COVID and I got through it fine. You didn't. You ended up in the hospital, and you were lucky in that, by the way, you're the president of the United States. And by the way, you're a millionaire. Other people cannot be that lucky. We need to put aside the politics. We need to put aside the skepticism in science. There's a lot of that rolling around too. It's shifted a little bit. It went from, no, there's no such thing as global warming, no, there's no such thing as climate change, to, okay, maybe there is, but we're not causing it. So maybe we can keep pushing in that direction of like, no, there is, and we really should get off of the fossil fuels. So we need to get rid of those things. We need to put those things aside. But it's a very difficult conversation to have, and we tend to listen more to our peers. In your example, your dad is more likely to listen to people who are like him in every sense of the word. And so if you can find somebody, the counterfactual to your dad, somebody his age, socioeconomic status, his family history, etc., who has gotten the vaccine, use them as an example. And that would probably push him more than an authority figure saying you must get your vaccine. Even you, as you might even be an authority figure in that equation. So somebody who are their peers, and we see this all the time. We see it with gun safety. So people who the government says, hey, you probably should put away your guns because the kids might get it. Oh no, you're trying to take away my Second Amendment rights. Fair enough. But then when you have the local gun club sell gun safes or sell gun locks, they buy it up and like, oh yeah, absolutely, this is a good idea. Thank you for doing it. It's super interesting, right? From a bystander, I'm like, what happened? What just happened? But that's how human psychology works, and at the bigger level, sociology works in that. Yeah, we tend to listen to our peers, and so that is what I would say to somebody. Like if your dad came to me and said, I'm really worried about the vaccine, I would say, well, look, there's so and so and so and so who are of your generation, they would understand, and they got their vaccine. Why don't you listen to them?
Dr. Najera also emphasized the importance of those untold stories in the history of vaccines.
I think there's a lot of untold stories in the history of vaccines, a lot of people that were involved. And we make the mistake sometimes of glorifying one person, the Faucis, the Jonas Salk for the polio vaccine. And in doing that, we exclude a lot of people from that discussion because, I didn't, somebody might say, I didn't go to college. I'm not a doctor. I'm not white. I'm not blah, blah, blah. I'm not that person. But the history of vaccines is very varied and very rich. And so you have Onesimus, who was enslaved, was African, became African-American. He was deeply involved in the history of vaccines, very, very influential in that. There are women, there are LGBT people who were involved in it. And I think telling those stories, and it's kind of what the project is also aiming to do in the next few months, the next few years, telling those stories also matter, because it also helps avert some of the influence that anti-vaccine people have. If you look at the anti-vaccine movement in the United States, they're mostly white men or white women of an upper socioeconomic status. They do not represent the variety of people in the U.S., but they still reach out, and they're doing a really good job of that, marketing like that. And so I think we can counter with the stories of men and women and people of color and LGBT community people who contributed to the history of vaccines that have led us to this moment when we can really, for the first time probably in the history of humanity, stop a pandemic without letting it run its natural course and avert the next one. And so, yeah, I think that's worth saying, that people should really research when people say online, do your own research. Do your own research, but look into the history of vaccines as it relates to people who are like you and who are not like you, and the contributions that they made, because those are also interesting stories, and that we can model towards our own understanding of history and understanding of science.
This was such a great conversation. I really appreciate you taking so much time to talk to me.
Yeah, no problem. Anytime.
As of June 5th, 2021, the U.S. has administered 301.6 million doses, and that number will continue to rise. For us vaccinated folks, it sounds like the next thing we'll need to do could be the COVID-19 booster shots, but scientists still don't have many answers about that yet. For now, the CDC recommends that everyone 12 years old and older get a COVID vaccine. For children 12 and older, the Pfizer vaccine is the only one available. This has been To Health and Back. Thanks again for joining me on this health history journey. Tune in next time for a discussion on the politicization of COVID. Until then, don't forget to rate the podcast and subscribe. Feel free to shoot me an email at healthandback@gmail.com, and I'm also on Twitter, Instagram, and Facebook as @healthandback. Thanks. See you next time.